Beautiful. Hi all, it's great to see everybody. We've passed the year 2020. We're all still here. So we're going to give it a few minutes to let people cycle in and get ready. We're going to get started just a few minutes after 12 to get us all going. And for those, I think many of you have already been here. So just to remind you all, we are video recording the session today. We also will keep the logs on the chat function. If you want to ask questions to Patty or to us, the rest of the R24 team here, feel free to put that in the chat. It's going to get recorded, and you guys can request a copy of that as well. We're going to post these materials on the website, and Patty's also going to be talking about some specific resources, and that stuff will also be uploaded to our website at the end of the seminar. I don't know how fast it goes, but we will definitely send you the email as always, so that you know when the materials are available and where to find them and what they are, so that you have all of that available. And certainly ask us questions if there's something you're looking for that you're not finding. And just so you know, we have muted everybody as you're coming in, just because sometimes there's background noises, but all of you have the ability to unmute yourself, and especially at the end of it when we're taking questions, feel free to do that. And if there's anything particular you need to cut in for, you all have that power. That's how we all start when we come into this room, with our mics turned off to reduce noise. John, do you want to see if your screen share is working already?
Yes, yeah, I think we'll just give it one more minute.
Sure.
And then we'll plunge ahead. Okay, can you all see my screen here? Fantastic.
Sure.
Well, welcome everybody. Really great to see you back. If you're coming back, if you're new, you're very welcome. We hope you keep coming to these the seminars we're having, the recovery seminars, our monthly series. This is the third in the series. So we're delighted to have you. Happy New Year to everybody. Today's talk is on recovery community centers and accreditation, a national perspective. It's the third in this series of recovery seminars, which are funded by the National Institute of Drug Abuse. Thank you, NIDA, for really stepping up to the plate and funding research to improve the recovery research infrastructure, the research infrastructure for recovery support services. This is, of course, part of a larger effort that Dr. Bettina Huppner and I are leading to really extend the research infrastructure in the area of recovery support services, one of which, of course, is recovery community centers. There are two major aims. One is to engage recovery community center stakeholders in activities that can advance the research in this area, and also to disseminate tools and products that we derive from what we do here and gather as part of what we do. We have a fantastic team, advisory board, one of whom is actually we're lucky that she's speaking for us today, Patty McCarthy. And we have Dr. Bettina Huppner, who you know is the co-principal investigator along with myself, and also this stellar team of really experienced people with lived experience, as well as researchers and advocates in the field. And we're really lucky to have such a fabulous group. In terms of the format of today, if you haven't been with us in the past, we have roughly 40 minutes of presentation with hopefully about 20 minutes discussion. If you could, as you're going through listening to the talk today, please post any questions you have or comments in the chat, and then we will be able to have that then for the archive, as well as we can ask some of those questions hopefully in the time we have at the end. So please put your questions or comments in the chat, because we do utilize that. That's part of what we want to gather, is your interest and your comments and thoughts and questions. So thank you for that in advance. And the goals are to foster discussion among multiple stakeholders involved in recovery community centers, to invite you all to participate and guide us in the research questions that we ask and try to answer, and to disseminate information that will be helpful and useful to stimulate research in this area. And these are some of the products that we'll be gradually accruing and posting on our website, recoveryanswers.org. The video recordings of these seminars, of course, will be archived there. You can access those anytime. Conference slides, presentations, summaries of board meetings, outcome reports, scales and measures that you can use to measure outcomes in recovery community centers, conceptual papers, and so on. So we hope you will go to the website, Recovery Answers, and check some of those resources out. We're starting to, as we ramp up the project, we're starting to get more and more stuff online. We also want to tell you about opportunities for funding. We actually have funding available for pilot studies, up to $30,000 for recovery community center research, particularly on people who are treated with medications for opioid use disorder. And we also have travel money for traveling to conferences, where if we ever get back to traveling, that is also available as well. And you can email Bettina. You can see at the bottom of the screen here on that. And this is our website. These are our web links. Please follow us on Twitter, LinkedIn, like us on Facebook, and take a look at Recovery Answers. We also have this monthly free bulletin, of course. You can sign up at Recovery Answers for our monthly bulletin, which translates and summarizes, contextualizes the latest research on recovery support services, including recovery community centers. So with that, I want to thank you for your attention so far. And I'm going to hand over to my colleague, Dr. Bettina Huppner, who's going to introduce our fabulous speaker today. Thank you.
Hi all, so I'm Bettina Huppner, and I am thrilled to be able to introduce Patty McCarthy to you. So I'm a scientist, and it's a real privilege of this R24 that I get to talk to non-scientists, to talk to the people who really need to be part of doing research on outcome for recovery. Patty McCarthy is our great speaker today. She is the Chief Executive Officer of Faces and Voices of Recovery, a position she has held since 2015. And I imagine most of you know Faces of Voices is an organization dedicated dedicated to organizing and mobilizing the over 23 million Americans in recovery from addiction and alcohol and other drugs. Prior to joining Faces and Voices, Patty was the Senior Associate with the Center for Social Innovation, where she served as a Deputy Director of SAMHSA's BRSS Tax Initiative. And for those of you who don't know what that is, I didn't. It stands for Bringing Recovery Supports to Scale Technical Assistance Center Strategy. Prior to that, Patty has served for a decade as the director of Friends of Recovery in Vermont, a statewide recovery community organization conducting training, advocacy, and public awareness activities. In addition to policy education, her work has focused on community mobilizing, peer-based recovery support services, and peer workforce development, and was instrumental in the development of a national accreditation standards for peer recovery service providers. Patty has a master's degree in community counseling and a bachelor's in business administration, and has been in long-term recovery from alcohol and drug addiction since 1989. And today, Patty will walk us through what it takes for an RCC to become accredited. And it's important for so many reasons, on the ground for those of you who are running RCCs to just hear more about it, but also for scientists and clinicians to understand all the rigor and standard and the details and all the work that goes into it. Knowing about each other, this is a great important part of what we're doing here, just really helps us. So she will talk us, what it takes and why it's so important. And a really great thing here is that Patty can give us a national perspective. We have done our research on RCCs mainly in New England and a lot in Massachusetts. And while we had these seminars in the past, a lot of you have commented and asked about some of the unique challenges and differences in different parts of the nation. And Patty is working nationwide, and she's heard these stories, and she's able to give us some more insight into these national differences and the insights. So I'm really thrilled and excited to introduce Patty to you, and glad to hear talk. Over to you, Patty.
Wonderful. Thank you so much, Bettina and Dr. Kelly. It's just wonderful to be here with all of you. And I can't say enough about how great it is to be part of the steering committee for this project and how important recovery research is to the recovery support services field, as well as me as an individual in recovery. Knowing that we can be part of something like this is just amazing. Our voices do matter, and our input into research is just critical. So thrilled that NIDA funded a number of recovery research grants, and that we're part of this one. So thank you for the wonderful introduction. I'm going to jump right in and let you know what we're going to talk about today. So my hope is that we will help you understand, if you're not familiar with, which is really amazing because I'm looking at all the people here and I know so many of you. And so I know you already know a lot of this stuff, but it's still great. I see a lot of new faces as well, but I want to shout out to folks like, I think we have somebody from Vancouver, Canada, and British Columbia. That's awesome. We have folks from Boston and Indiana and California and Florida and Cape Cod, India, all over, Texas. So this is just a real symbolic of how powerful this recovery movement is all over this nation. And actually, and Faces and Voices works internationally. We have Faces and Voices of Recovery, United Kingdom, Canada, Brazil, South Africa. So this is a worldwide movement. But anyway, coming back to why we're here today, I'm gonna just talk about, I've heard people say, what's the difference between an RCC and an RCO? And that's alphabet soup, but that means our recovery community centers, recovery community organizations. And what is ARCO? Talk about that. And what is CAPROS, which is the Council on Accreditation of Peer Recovery Support Services. So those are the big acronyms that I'm going to be using throughout my talk today. So we'll talk about a little bit about getting into the standards, the national standards for accreditation, and what happens after, what are the benefits, and how we're moving the field forward from a national level to advocate for adoption of national standards so that we can be maintain the integrity of peer services and the work that you are all doing out there. So we're going to start out first with a poll to find out who you are and ask a few questions. So we're going to take a minute or so, and he is just going to run the poll. So please participate. We want to know, who are you? How do you identify? And then you'll get a second poll following this one. Remember, you can check all that apply. More than one answer.
Well, I did finally find out how to unmute myself. May I begin? My name is Dale Hull. I live in Petoskey, Michigan, just south of the bridge to the UP. I'm Executive Director of Community Recovery Alliance in Petoskey, and we serve, we like to think we are serving properly, and at least trying to, recovery organizations in northern Michigan. Southern Michigan, not the UP.
Dale, welcome. Glad to have you with us. We're going to continue to mute folks just while we have the presentation, and then if you have thoughts or comments, we can continue after Patty's talk. But thanks, Dale, for saying hello. Welcome. Glad you're with us. How are we doing, Hazel, on the poll?
Right now, 59% of people have voted, so we can give it a few more, like maybe 30 more seconds, because there's.
Yeah, it's a little bit more reading in the second one.
Remember we have to scroll down.
yeah, yeah. I had to really think about the second batch there. But thank you, everybody, for taking a minute just to read through and answer as best you can.
Hazel, Katie, any idea why the submit button wouldn't be working? Do you have to check at least one answer for each of the 2 poll questions?
I think you have to answer both questions. There's options for none of the above for the first one. But...
Yeah, when the poll pops up, you just have to scroll down. It only shows the first question.
Right, and then it's on the right-hand side, a little scroll thing.
How are we doing now, Hazel?
Okay, we're at 77% now, so I'm going to end the poll if that's okay with everybody.
That sounds good.
And should I share the results now, or do we want to maybe wait?
Yeah, give them a quick spin out. Yeah. So this is who we have. This is who you all are. And a lot of folks from recovery community centers, which is fantastic. Recovery support staff, recovery advocates, people with lived experience, fantastic. And these are some of the other questions. The orange bar means that's the winner. That's the highest one. Is that right?
That's right.
I'm aware that you can go through a peer support. So a lot of you are aware that people can go through a peer support certification process, which I think is good news. And then the next highest one was, I'm aware that RCCs and RCOs go through a rigorous process in order to become accredited. Okay. A lot of people know that. Okay, well, this is really great to have. Thank you for doing that, and let's continue with Patty.
Yeah, that's great information, is to see where the baseline is. So some folks have more knowledge around peer support credentialing certification than they do about accreditation, and that's why we're here today. We're going to talk a little bit more about that. So. What's working well? We always start out with what's working well. There's a lot going on everywhere across this country, especially around, what's going on in Capitol Hill, what's going on at SAMHSA, the Substance Abuse and Mental Health Services Administration, the money that's coming into the states to fund these services. There's a lot of good stuff going on. And so I want to highlight that we do have a growing national network of recovery community organizations all over this country. So there's several hundred that are actively involved in their communities, and they do a lot of different things, and we'll talk about that more in a minute. But we've also know that there's data that being collected to show that peer support works. And previously that was mostly true for mental health peer recovery. There was a lot of research on that early on. But now, because of the recovery community organizations and recovery centers and all other recovery institutions, there's data now, a lot more data being collected. And now there's just a report that came out documenting that there's even more need for peer support specialists. And I use that word interchangeably with recovery coaching, recovery navigators, whatever peer role that is in the CAPRS model, we call them peer workers. So, and accreditation is on the rise, and it's helping organizations in many different ways, but particularly to sustain the work that they're doing. So what we do at ARCO, then it's an association, so it's a member or association, and bring together individuals, or we bring together leaders of recovery community organizations across the country to advocate together, to learn together, to share best practices with each other, to meet regularly with each other so that they can have a voice in how we do this, how we inform research, and lots of other ways to work together. So ARCO provides training and technical assistance and helps to have a voice for the organized recovery community. You'll see on a lot of these slides, which you'll receive after, there's links to the information that I'm referring to and what I'm talking about. So at ARCO, we've worked to establish what are the best practices of recovery community organizations. How do you know that they're a recovery community organization? They're all of these things that we started back over 20 years ago, looking at organizations that were led and governed by the recovery community. They're nonprofit organizations. They focus primarily on substance use disorders, and they engage the people in the community in a grassroots effort. So it really reflects the community that's served. So we get people together that are family members, allies, other service providers, but essentially it's the recovery community that is doing this work. That they use a participatory process. We're going to discuss more about that in the accreditation standards as well. But that essentially means that people in recovery have part of the decision making, and they have a say in how things are going. They get to decide on what the programs are going to be offered, and evaluate how things are going. That many of them are providing peer recovery support services. They all are grounded in the principle that we support all pathways towards recovery, all pathways of recovery, all pathways to recovery. So there's a lot of that's just a core principle that many may focus on, say, just faith-based, or there's harm reduction approaches, but all of them appreciate and support and don't deny people their pathway of recovery. So that's one of the core best practices. They are building diverse, equitable, and inclusive policies within their organization, using recovery-friendly language, meaning non-stigmatizing language, and they operate on a code of ethics and have grievance policies in place. These are what the members of many RCOs, recovery community centers, recovery community organizations, came together to identify as best practices. These are all available on our website. I wanted to just show you also there's a range of types of recovery community organizations. Local, so they serve just a county or a city, or they serve a region, so they might have several parts of their state that they serve. And then there are statewide RCOs. Also national organizations that are recovery community organizations, and international. So organizations, you'll find all of those and can identify them by clicking on various places on the map of the United States. You can also see there's a lot more growth of RCOs and RCCs on the East Coast of the United States. But we're hoping to see some more develop in all 50 states. And our goal is to see a statewide RCO in every state in the United States. So let's talk about that. What is the role of a statewide RCO? It's different. It may be different than a local recovery community organization. They do the coordination and networking. So they bring together all the other RCOs across the state. All of the recovery community centers and recovery community organizations. They may have the role of advocacy and advocating at the State House and with policymakers. There's single state agency in your state. They also do a lot of public awareness and education. So stigma reduction campaigns or messaging campaigns in the state. Oftentimes they're providing training and technical assistance to providers across the state, but also the RCOs and recovery community centers that they support. So that and many times they are creating their own legislative advocacy agendas. Most often it has to do with appropriate funding and access to recovery support services. So you'll see a variety of them posted here. These are all from all over the country: Massachusetts, Utah, Missouri, Pennsylvania, Georgia, many, many more. I just threw a bunch of them up there because to give you an example of what's going on, and some of you may be here today from those organizations. So here, let's get down to the definitions. So, you know, most RCOs operate a recovery community center. I would say probably 90% of them do, or 95% of them do. The ones that I showed you that were statewide, they may not operate a recovery community center as an RCO because they're busy doing all the advocacy and the training and the speakers bureaus and the education and that's the work that they focus on. But any RCO is an independent nonprofit organization led and governed by the representatives of the local recovery community. They're doing any combination of these three things: organizing policy advocacy efforts, carrying out community education and outreach, and or delivering peer-based recovery support services. And most of them do that by starting a recovery community center. So they, you know, my own experience, it goes back many years when we began establishing recovery community centers in the state of Vermont. You know, putting together a board, putting together the community advisory board, getting the feedback from the community, doing a needs assessment, knowing why we exist, what is our mission, why are we in that community, and making sure we engage the community in deciding what that's going to look like. So here's a sample of other recovery community organizations. I see Maine, Idaho, Washington, South Carolina, Georgia, Illinois. But again, this is the only distinction is that most RCOs are operating recovery community centers, which is why we're all here, is to talk about the effectiveness and the value of recovery community centers. But they are the physical locations where the recovery support services are provided. Now, I have this concept also about recovery community centers without walls, or RCOs without walls. And that's because in many cases, resources may not be available to operate a bricks and mortar recovery center. And so you may be an office somewhere where the folks that work at that organization are getting together, but they may need to use space at another building, a hospital, a school, the churches, but they still operate all of their programs. They can meet with people for recovery coaching. They can go out and they can host town halls. They can do telephone recovery support from an office, but that's not, you know, so that they're doing outreach and they're still doing peer support, but they may not have the resources to operate a recovery community center. So I just wanted to throw that out there, that idea of recovery centers without walls. Also notice, just to throw this out there, there are many states, or there are a number of states anyway, that have created networks. So they work together with all the other recovery community centers in their state. And these are just a couple samples, but in Maine, you see a map there. And if you click on that link, you go to the map. There are a whole host of recovery community centers. They make this clear. These are not clinical services. These are all peer run services. And they're things that are done based on the needs of the community. So they have actually the participants decide, we need a resume writing group, or I want to do, you know, knitting with other parents that are in recovery. You know, that's the idea of participatory and deciding on what they're going to do. So they're all geared to what's the needs in their community and who is involved in their programs. So there's also, this is a screenshot of the Vermont Recovery Network and all of their recovery community centers. But the interesting thing is that, and I may miss one, but Maine, Vermont, New Hampshire, Massachusetts, Connecticut, New York, Rhode Island, all have networks of recovery community centers. Isn't that incredible? That's like the Northeast. I have to add, Georgia has a network. New Jersey is creating a network. There are other states that are creating networks of recovery community centers. But the beauty of it is that nobody needs to like go reinvent the wheel. They get to share with each other on how it's working. How did they set up their policies and procedures? What are the challenges that they've faced? How are they seeing great success, and and they could share that with the other centers. And that is the real beauty of a network. And that's why we're talking about like the physical locations of recovery community centers are critical to be. And the other thing is that I know from my experience, we very early on said that these centers are not going to be hiding in back alleys. They belong right on Main Street. They could be storefronts on a small rural community, but they should be welcoming and allow people to come in where they're at, and they don't need to be hide. So that's my belief in what's the most successful is just integrating it as, I think of this as, in almost every county, or you're probably familiar with senior centers, community centers, youth centers. This is a recovery center. It's a valuable part of the community, that a physical location where people of that population, people in recovery, come together and meet, just like a senior center who need services. They come there, they get activities, they meet other seniors, and they provide each other peer support. So there's a lot of similarities, and I think that we need to make the case that this is just a part of the community. We deserve the support and recognition and funding to make that happen. So just in case you're interested, and I know many of you are already participating, but this is a photo of all of the ARCO members, RCO directors, board members, volunteers, people who went to Capitol Hill to meet with their members of Congress to explain exactly what I was saying, why we need funding for recovery community centers in your state. But they also talk about other policy issues, the barriers for people getting into recovery support services, removing discriminatory barriers in the criminal justice system, all of those things that we try to advocate for. But these are many of the reasons why we have been a strong voice, is because we provide these benefits to our members. There's also an executive director support group that began at the beginning of COVID, when there were real challenges with opening centers, closing centers, how to reach your participants. So we started last March, and it meets every single Wednesday, where the executive directors of all those organizations talk together to find out what's working, what do they need help with, and they provide their own peer support on an executive director level. So the good news is that we've been collecting data about these recovery community centers and recovery coaching and telephone recovery support for over 3 years now. We've had over 60,000 participant records, and big news, right? Peer support works. Didn't we all know that? Right. But the outcomes, and this report is available. It will be sent to you, but it is also available via link. And you can go to the website and learn more about this particular data collection tool called the Recovery Data Platform. There are several, there are a number of tools out there, but this one actually uses the Brief Addiction Recovery Capital Index, which is a 10-question survey. And then it also uses the outcome rating scale and relationship rating scales, and it has a whole other optional tools that can be used and tailored to the organization. But the reason why I'm saying this is that this came out of the expressed need of RCCs who said, we're doing this work, but we need to demonstrate to our funders and potential funders that it works. So they came up with what were a common set of elements, common set of data that they wanted collected. And that's really cool. And that's kind of like, it's it's a foundation, or it's a starting point in this research that is so important. With this grant is going to, be able to look at all of the various data that is collected from different platforms, different tools, and be able to demonstrate and help us to make the case for why this works. So we're super excited to share that with you. The results are astounding. Basically, just more information about the BARC-10. There's a link here. It goes to the Recovery Research Institute website, but it is essentially a 10 questions that align with the domains of the Recovery Capitals assessment. And the original one was 30 questions, but it was narrowed down, and it makes it much easier to use when you're working with peers in this type of a setting. That's not a clinical setting. So some of the questions or what they're answering may be things like, now that they're engaged in peer support, they're participating in recovery coaching, they've set goals, they're accomplishing their goals, but they get these questionnaire periodically, and things they might answer are, there are more important things to me in life than using substances. Or in general, I'm happy with my life. I have enough energy to complete the tasks I set for myself. I'm proud of the community I live in, and I feel part of it. I get a lot of support from friends. So this is how we're measuring that recovery support, peer support works, is that they're taking these assessments periodically while they're engaged in recovery coaching or telephone recovery support. So that's just a brief information about, there is a document that is going to be sent out with more information about this particular tool. And maybe at the end, Dr. Kelly could talk about it because he's the expert, not me. Anyway, so what we know is, after recent research, and this report was just released last month in December from SAMHSA. They conducted a behavioral health workforce report. Again, the link is there, but I would encourage everyone to, and it will be sent out with your resources after this webinar, but it has a part of it that has a table, a chart that explains what is the need, the projected need to meet the demand of all of the people in the country that need support for serious mental illness, serious emotional disturbances, and substance use disorders. So it breaks it down according to that. But when you narrow it down and you look at what they calculated regarding peer support specialists, right now this report says that there are 23,000 certified or existing peer certified individuals in the country, and that the need just in the substance use disorder world is nearly 350,000. So this report just came out, and it is a case to make for you to use, saying, peers can work in a variety of settings. They can, we believe that the recovery community centers are the hub of the recovery community. They can be working in those centers, deployed from those centers out to emergency departments, drug courts, child and family services. They can work with law enforcement, but this is just the most recent data that we've seen, documenting the need for even more peer support in both substance use and mental health. So there are a lot of resources that have been created over the years, but I want to assure you that, across the infrastructure for recovery support services, which I consider there is a national infrastructure, it's being developed, it needs further development, but it's been around for, 20 something years, at least, when we look at things that, like recovery housing, collegiate recovery programs, recovery high schools, alternative peer groups, and recovery community organizations. Each of these have national standards. They are either best practices or they are actual accreditation standards. But there's, so you'll see the links to all of those, but I wanted to just start by saying, you know, for the peer worker themselves, they will go through a certification process. They follow core competencies and training guidelines for what they need to become certified. But for organizations that are delivering the services, like recovery community centers, recovery housing, collegiate recovery programs, recovery high schools, these accreditation is for the organization and not for the individual. But here's another look at what that means. Certification is given to individuals, accreditation applies to the organization. Certification is a voluntary process in which individuals can demonstrate they are proficient in that specialty. And then accreditation is also a voluntary process, but it's where the organization's operations and their programs are evaluated based on standards. So this is where CAPRS comes in. And you can see all about it on the CAPRS website, which is caprss.org. And that is the Council on Accreditation of Peer Recovery Support Services. So this CAPRS was established a number of years ago, I want to say 2012, where SAMHSA provided some federal support to convene folks from recovery community centers, recovery community organizations across the country to bring them together to look at national standards, creating an accreditation model. And we, you know, those of us that were involved with it and the policymakers at that time still, and it holds true today, to make sure that there is a gold standard for organizations that are providing these services, that it leads to the credibility and integrity and and maintaining the authenticity of what service providers do. So I need to move quickly through this because I know time is ticking. And I just want to assure you that all of this information is available on the CAPRS website. But the mission is to identify excellence and to help organizations deliver their services. It is very much consultative rather than prescriptive. It knows that each organization is different, but the CAPRS team is available to consult with folks. It is also the only accrediting body in the United States solely focused on peer recovery support services. But it is just as rigorous as CARF or the Joint Commission, those are accrediting bodies that are accrediting treatment providers and other organizations. It offers services for those that are just getting started and thinking about this, but it's also working with, we're working with state entities across New Hampshire, Massachusetts, other states where they are saying that they want their organizations to be accredited, and so that we're working with them to assist with that. So I'm going to give you a quick snapshot of what that looks like. This is where you'd want to participate in a Accreditation 101 and Accreditation 201 webinars. It really digs into the taxonomy of it. There are, as you see, there are 4 functional areas, 7 core domains, 30 core standards, 150 criteria, and under each of those, there are elements of a performance. So just quickly, remember the 4 Ps: principles, practices, people, and performance. Those are the areas, the domain that are focused on. And in the accreditation handbook or resource book, which you'll find on the CAPRS website, we'll just look at the domain of recovery principles, culture, and climate as an example here. Core recovery principles means that the program is grounded in the values of the recovery community, both at the local community and the national movement. I'm just going to dig a little bit deeper into that one, because if you follow this along, you see the functional domain is under principles, functional areas, and then the domain, and then the standard, The criteria is putting recovery first. And then the reviewers will look for things, the elements of performance. That there's a design of peer, the design of peer supports is based on recovery strengths and resiliency. The program gives a positive face and voice to people in recovery. And that signage in the facility, in the center, uses recovery language. So there's a breakdown of this particular criteria or domain that we would go through, and we look at things like, do they use participatory process? Are they maintaining the authenticity of peers helping peers? Are you building leadership within your organization to help people grow and lead the program and has a voice in their community? Celebrating, that's part of the recovery community. We celebrate each other and our accomplishments, having milestones recognized, whether it be somebody just, got their children back. They just celebrated 60 days of recovery. There's all kinds of celebrations, but it's very welcoming and affirming. And how do we, so I mentioned participatory process, but this is just really key to it. And it just means that, it's not a couple of people at the top making all the decisions. It's grassroots. It comes from the bottom up, and we ask people, what do you want here? And how can we serve you? Servant leadership. The climate, the climate in an organization is like the weather, how warm or cool it is. If the weather is good, the climate is good, we're going to have new people that want to come in. If there's a poor climate, there will be high turnover. There will be low participation in the program, levels of mistrust, and a lack of momentum for doing great things in the community. So I'm almost done here, but I wanted to say part of the accreditation process is looking at, documents. Coming in, the site reviewers come in and they look at, how is your team working together? Is there a posted code of ethics? Things that will demonstrate that these are the standards, that accredit organizations that are delivering peer services. They will do interviews. They'll have focus groups, and they'll listen for examples of principles in action, which we call tracers. So a couple of organizations that provided some feedback to us after they became accredited, I wanted to mention. The McChin Foundation is in Richmond, Virginia. Favor Greenville is Greenville, South Carolina. The benefits have been great. We're able to leverage our status when we meet with policymakers and advocate for RCOs, and we're taken more serious in the state agency world as well. And then this has benefited our organization and provided clear guideposts as we move forward in the expansion of peer services in South Carolina. So it's really, it is guidepost. It's like having a manual. It's like once it's done, it's an incredible value to the organization, but it is also setting people up for future, contracts and funding and recognition in the community. So after accreditation, people go through, they update their organizational profile. They may have to comply with a performance improvement plan, which simply means they're making some changes post-accreditation, but they met the criteria for accreditation. There's a learning community, and they become reaccredited at some point. So here we are, moving the field forward. How are we going to move this field forward? By doing this, I think that we are with recovery community centers and RCOs, it leads to more sustainability of our field. When we are advocating at Sampson and at Congress for funding go to the states to fund the growth of recovery community centers and RCOs, we need to be able to say, look at the amazing work that they're doing. It assures fidelity to the peerness. We cannot lose the peerness. We cannot lose that. We cannot be co-opted from other, parts of the behavioral health system, because this is unique and we have something valuable to offer, and it's growing like wildfire all over the country. And this helps us to develop new leaders and to create true recovery-ready communities. and I want to make sure I mention that, a recovery ready community is not just that recovery community center. It's the housing programs and the colleges and the high schools and the groups that are going on across the community, and really changing the way people view recovery, changing hearts and minds, helping us to make a difference and continue to do the good work that you're all doing. Whew. All right, so I could take a breath now. And I have to ask you one more time now that it's heard of this. Have you learned anything? So before we open it up for questions, I think, is that correct, John? We do the poll? Yeah, Hazel. Okay, so now has anything changed? Are you more aware of some things? Take this quick poll and then Dr. Kelly's gonna take some questions.
Well, while everybody is doing that, first of all, thank you for answering the question. And Patty, that was just so inspiring. When I'm just zooming out there and just thinking, what's happened in the last 10 to 15 years in this field is just completely amazing. And you've been so instrumental in that and making this happen. But I mean, just looking at all those accredited agencies for different recovery support services, just how far the field has come, right around the country, and it's just it's really phenomenal. I mean, it's just the train has left the station and it's picking up all this momentum, and I think it's unstoppable in a good way. It's not out of control yet. It's unstoppable, though, in a good way. And it's just fantastic to see. And that was just a masterful overview. Thank you for providing that for us. All right, well, we're going to open up the mics. So if anybody has a question that they'd like to pitch to Patty, please speak up. We also thank you very much for posting the questions in the chat. Very good to do that, as I mentioned. But does anybody have a question for Patty?
I don't have a question, but my name is Zach Rasmussen, and I work for USARA, and I am Utah Support Advocates for Recovery Awareness, and we use the RDP quite a bit. And I use the BARC and the engagement scale to process and to engage a conversation with my peers, and without the RDP, it would be difficult to do that. And I am a person with lived experience. I know we got doctors and scientists on here, and you guys are awesome, but I got my doctorate in lived experience. And I would love to talk to each and every one of you guys. So that's all I got. Thank you. And I couldn't, the RDP is awesome and I love it. And I enter at least 20 times a week.
Thank you for that. It's great thanks for sharing that. Awesome. Thanks for coming. As always, good to see you again. And the RDP is a real boon, I think, to the recovery support services field. And it's great that we've got so much data being collected through that platform, and it's actually showing, practical value in actually speaking to people, providing data points from which to start a conversation that can engage people and hopefully help people. So thank you for that. Other questions?
I'm Thomasina Borkman, George Mason University in the DC, Maryland, Virginia area. I've seen in mental illness that a lot of peer support is actually being defined by professionals and is being colonized by them to be really clinical services. So my question is, how do you define peer? How do you define peer support?
Thank you. Patty?
Sure, that's a great question. In the work that I do, and this is specifically around recovery community organizations, the peer is defined as a person with lived experience from recovery from addiction, alcohol or drug addiction. And there are other definitions that include a family member. So there's also family peer support workers. But in terms of a peer, it's somebody with lived experience of recovery from alcohol or drug addiction in the work that we're looking at. Now, I always emphasize that it's not that they have experience with the addiction. What their value is that they have experience with recovery. So what that looks like, how they overcame challenges in early recovery, how they've maintained their recovery, however they define that, that's the value of what they're there to offer as a peer support worker. Not because they've had a history of addiction. So the commonality is the lived experience that makes them a peer.
Excellent. Thank you.
Thank you for the question. Other questions?
I have a question, if you can hear me.
Yeah.
Okay, great. So I have really quick 2 questions. So in one sentence, how would I explain the difference between ARCO and CAPRES?
Sure.
And then that's my first question. The second question is, as a brand new RCO, is it even possible to get accredited yet?
Second question first, no. The short answer is CAPRES will accredit organizations that have been delivering peer services for a minimum of 2 years.
Okay.
So the first question, ARCO does not accredit anyone. It's not an accrediting organization. It's a membership association. And it simply means that an organization in whatever stage you're in, it doesn't matter, you can apply because it gets you into the system. You kind of start to learn more about what goes on with other RCOs, but it goes through an application process where I think, current ARCO members are on a committee that reviews every application. And the reason, so if you look at those 10 best practices, that's what they're evaluating. So when you submit an application, they look at those 10, how you answered those 10 questions. And that's key because they will go through every single one of those. They will look at your website. They will even set up a call with you to learn more about where you are in the process. But the reason why it has to go that way is because we want to protect organizations who rightly should be eligible for funding in states. And if there's something that comes out that says RCOs, but that RCO names itself an RCO, but is actually 80% clinical services, then we want to make sure that they don't get through to, that process with us. Because there are some states that are they will ask, are you a member of ARCO? Can you show us a current membership certificate? So you will get a certificate of being a part of ARCO, but you will not get certified. It's just a certificate as went through that process. So that's an important piece to know, is that we don't certify our organizations. We give them certificates of membership, which means they passed through that process.
Perfect. Thank you.
Sure.
Thank you.
As part of that process, you have that they're led and governed by the recovery community. Can you define how you define recovery community? Because I know that can be personal lived experience, like you hear a variety. So how is that defined?
Sure. Well, in the movement of recovery advocacy, we think of the recovery community as people in recovery, their family, friends, and allies. But for the specific purposes of a RCO, it's 51%. So the majority of the board of directors will be in people in recovery in their own recovery. There will also be family members. There will also be allies. There will be, and of course, there's a lot of things that, you want to look for in good board members. But the core, the defining number is 51% are people in recovery from their own substance use disorder.
Thank you. All right, we've got maybe time for one more question.
I have a question.
Yeah.
Hi, Patty. Peggy Vazina in Western Mass. I have a question. I was intrigued by your mention of peer recovery centers without walls. And it really speaks to a lot of the thinking that we have these days around how to make recovery support services more accessible and more inclusive and address issues of inequities in our communities. And that has led us a lot to the idea of utilizing recovery coaches or recovery coach specialists. Is there any conversation at the national level around some uniformity around what constitutes a peer recovery coach? I've seen some in behavioral health settings that are not, they're not actually people in recovery. So I know you're almost out of time, but could you speak to that a little bit, Patty?
Yeah, sure. I mean, that opens up a huge can of worms that I can answer in 1 minute. But no, I'm thinking. So a lot of people get mixed messages because there are this professional associations of recovery coaches that are almost like sober escorts and stuff like that. That's the one extreme, right? And then there's you guys boots on the ground, nonprofit organizations and state entities that are working on certification of people in recovery that go through a training program and they become recovery coaches. And the common definition, I think we just need, it's a state defined term. I think every state defines it because they're the ones creating the certification process. And that's okay. I actually think that I don't know that it would serve a purpose to have a national certification. I think each state is unique and it needs to be, unique. The idea, we are, however, addressing how the inequities of Black, Indigenous people of color getting into this workforce and being leaders in this workforce that we need to pay serious attention to, because we are not serving in a culturally congruent manner, but we're also not elevating the voices of people impacted by systemic racism and the actions that our organizations and systems have created. So we need to first accept that there's an issue. Second, we need to start doing some changes in how we find people. I always say, an RCC and RCO has to reflect the community you serve. So you need to figure out how we need to do better. We all need to do better in bringing people impacted into the workforce. Hope that helps.
All right. Well, Patty, thank you. And sadly, we're out of time. This has just been phenomenal. What a wonderful presentation, just masterful. Thank you so much, everybody, for coming. Stick around if you want. We will end the recording now, I think. But if you want to stick around and just chat, we'll be here for a few more minutes. But we want to formally end it because we know people do have to go at 1. But thanks again. Look out for the email for the next one, which will be coming up in about 4 weeks' time. So stay tuned. Thank you. Have a great weekend, everybody. Thanks for your input.
And thank you so much, Patty. This has been great. Love it.
Thank you. Great to be with you all.